most popular misconception that I come across in practice is when patients don't understand the difference between type 1 and type 2 diabetes, and they feel relieved when they're told they've got type 2 because they say, oh, I've got the better diabetes.
So common misconceptions will include things like, how many years have I got to live, doctor, or when will I go blind? So those kind of things are obviously in the back of patients' mind when we talk to them about diabetes. It's very important to set that right from the outset.
Well, it's important to make sure that you're still caring for your patients. So in my practice, we work as a team and we utilise all our members of staff. So patients would come and see our healthcare assistant first, get the blood test, the blood pressure, the weight, the height, the waist circumference, and then they would come and see practice nurse about a week later, at which time we would have all the results so we could then discuss their HbA1c, the cholesterol, recheck the blood pressure if needed, check the feet. That's how we would do it to make sure patients are getting all the checks, but also that patients are getting time to talk and ask questions as well.
And my first consultation almost invariably is simply listening to what their concerns are and resisting the temptation to come up with lots of solutions, because they're still in a bit of a shock, they're still trying to take information in. So I normally sort of plan the consultations over 3 or 4 consultations over a period of a couple of weeks to make sure they're taking everything in.
So at first diagnosis, I would make sure that they understand the concept of diet and exercise, and also that it's a progressive condition and it may well lead them on to requiring insulin. So I would really want to mention that at the first consultation.
Listening is very, very important. Listen to where they're taking the news, listen to their concerns, listen to what they think diabetes might mean for them, and listen to what their underlying knowledge is of diabetes, because they come up with a lot of things which are totally valid, but there are some things they're very anxious about which they might not need to be anxious about. So listening, very important. I want them to be not so alarmed or anxious by it and know that they've actually got a helping hand, a supporting hand, as opposed to a judgmental hand who's going to be working with them. And that actually it may take a long time to get it sorted out properly. It's not a 1 day or a 1 month solution. I'd rather work with people and make lifelong changes than try and get a crash diet or crash something out of it. So that's probably what I'd like them to go away with.